Hey guys, this is Jason Duprat here, and anyways, I'm just going to share with you some common questions I get from my students in my course, the Ketamine Academy course, where I teach providers how to start their own healthcare-related practices. So the most common question I get is typically from nurse practitioners or CRNAs, and they ask whether or not they can start their own practice in their state. And so the answer is absolutely 100% yes. Every CRNA or nurse practitioner can start their own practice in all 50 states. There is a little bit of finagling and understanding that you have to do when it comes to how you structure your practice and making sure that you keep your practice operating within your state's scope of practice for the providers that are working in it. So one of the easiest tools that I've found to get a quick overview of whether your state is an independent practice state, a collaborative state, or a supervisory state are these maps here that were some of them were made by the National Council on the State Boards of Nursing, and then another one I'll show you here was made by the American Association of Nurse Practitioners. But these maps give you a really quick overview for your specialty, whether or not you can practice independently. For some reason, they took these maps down about a year ago. I'm guessing it may have been just too hard to keep this information up to date because rules are changing super fast, and typically, in most states, it's for the better. Nurse practitioners are getting more autonomy. Their rules are getting more lenient because of the shortage of healthcare providers. And so what we can see here is a map for nurse practitioners. And the states here in the blue, as you can see, if I scroll down here and show you the legend, are independent practice states. These states allow nurse practitioners to function independently without physician supervision. According to this organization, they consider collaboration that does not have to be in a formalized written arrangement to be considered independent. And so you'll see that there's quite a few states that allow independent practice here. Every state in the red does not allow independent practice. So that's a really quick go-to reference guide for you guys. If you can find something similar, if you want me to shoot this over to you, I can shoot it over to you as well, or you can take a screenshot. There's another map that was put out by the American Association of Nurse Practitioners, and this is the map here. And this one breaks it down a little bit further into three categories, so full practice, reduced practice, or restricted practice. And so every state in the green here for nurse practitioners is an independent practice state. Everything in the yellow requires some sort of collaboration or is restricted practice in some way. And then everything in the red is the most restricted practice. And these states in the red require physician supervision. And then here's a map for Certified Registered Nurse Anesthetists, CRNAs. Everything in the blue is independent practice or a non-formal collaboration. Everything in the red is independent practice, and then the ones that they kind of outline in the white here are not clear data, or some states, this may have just recently changed, but some states like New York were classifying CRNAs as RNs. They didn't have their own advanced practice license, which I think that may have just changed. I know there were some rules going through. But that gives you another quick overview for CRNAs on what your practice requirements might look like in your state. To get the full detail, the full wording and language for what the practice rules and requirements are, you need to go to your State Board of Nursing website. And so some states make this a lot easier than others. Some states like Tennessee, it was like a horrendous website, and it took me like 3 hours to find the Nurse Practice Act in it. They did an absolutely terrible job of making it easy for anybody. But New Mexico did it pretty well. All you have to do is go to their website, click on menu. Over here, they have rules, laws and rules on the side, and then click on Nurse Practice Act. That allows you to download the Nurse Practice Act. And this one is actually pretty short and sweet. One of the shortest ones I've seen. It's 31 pages, and it outlines different things that nurses are allowed to do. It gives definitions. It breaks down the rules by your nursing license type. And so to find out for nurse practitioners, for example, what the rules are, you would just use your search bar. We should probably scan the whole thing. It's usually a pretty good idea to have a basic idea of what everybody's allowed to do. But if you want to know specifically what your license allows you to do, then for nurse practitioners, you would go to the section on Certified Nurse Practitioners, and the rules are right in here. Again, New Mexico is really short and sweet. Some states are really, really, really long. And I've seen Nurse Practice Acts that are hundreds of pages long. They definitely don't make it easy in some states. But right here for Certified nurse practitioners. We're in that section right now. You can see here, this part here, part B, it says certified nurse practitioners may, and then it outlines what they're allowed to do. And number 1 here, it says perform an advanced practice that is beyond the scope of professional registered nursing. And then it also goes on to say that certified nurse practitioner may practice independently and make decisions regarding healthcare needs of the individual, family, or community, and carry out healthcare regimen. So right here, it's very clear that in New Mexico, nurse practitioners can practice independently. It has the language right there, very clear to see. Obviously, you want to read the rest of the language in your section to see if there's any other restrictions or anything like that. You want to understand the entire section of your Nurse Practice Act, but very clear, nurse practitioners are independent in New Mexico. Now, if CRNAs were to do the same sort of search, it's actually really easy. It's only 1 paragraph down. But in New Mexico, here's the section for Certified Registered Nurse Anesthetists. And the section that we're most interested in right here, I've already done the hunt for us. It says a certified registered nurse anesthetist may provide preoperative, intraoperative, and postoperative anesthesia care and related services. And goes on to say that you're allowed to order diagnostic tests and things. One thing that's pretty common among CRNAs and Nurse Practice Act rules for CRNAs is that they limit the location where a nurse anesthetist can practice. And so here you can see that that's very clear. They limited it to the perioperative, intraoperative, postoperative anesthesia care and related services. I believe somewhere if you go down, it talks about labor and delivery as well. But you can see that this is a limitation on the location of practice. And so that's something that you want to check into if you're a CRNA and thinking of starting your own, freestanding clinic is, am I going to be operating still within the scope of my practice if I have a freestanding clinic? Here in the next section, you'll see that it says that certified registered nurse anesthetist shall function in an interdependent role. And so because it says interdependent, that's a keyword that this is not going to be an independent practice state, which it's not. There is some confusion amongst CRNAs, which is pretty easy to make actually, but they feel and believe that because a state is an opt-out state, that they are allowed to practice independent of a physician. Whether or not a state is an opt-out state has absolutely zero to do with whether or not you can practice independently. What an opt-out state is a state in which the governor has made a ruling that states that government insurance will still reimburse the CRNA without requiring that the CRNA be supervised by a physician. And so opt-out is a term that's used for billing purposes. It doesn't have anything to do with what you're allowed to do in practice. It's not your Nurse Practice Act. Your Nurse Practice Act is going to tell you if you're independent or not. The opt-out just tells you whether or not you're going to get paid as an independent provider. So that's very key that you understand the difference there. So now that we have that clarified, we'll continue here with the certified registered nurse anesthetist scope of practice. But here you also see that it states that the CRNA is a member of a healthcare team in which the medical care of the patient is directed by a licensed physician, osteopathic physician, dentist, or podiatrist licensed in New Mexico. And so that's another common phrase that you'll see in almost every state, that if you have to have a supervising physician or collaborating physician, it is going to have something like that. It's going to outline which type of doctors are allowed to supervise you or collaborate with you. And so this is really, really common. Most of them say that it can be an MD, a DO, a dentist, or a podiatrist who can supervise a nurse anesthetist or a nurse practitioner. And so it goes on here to say that the certified registered nurse anesthetist shall collaborate with the licensed physician. It just renames those same specialties and licenses, and then it defines what collaboration is here. So in the state of New Mexico, it says collaboration means the process in which a healthcare provider contributes his respective expertise. Collaboration includes systematic formal planning and evaluation between healthcare professionals involved in a collaborative practice arrangement. And so in New Mexico, you have to be able to demonstrate or document that you've collaborated, that one of these physician types has given their input relating to the anesthesia care of the patient in order to remain within the scope of your practice. And this language is similar. Keywords that you want to look out for in different states are the words independent, interdependent, and collaboration. And so those are going to give you a really good idea of what the rules are. Again, you have to read through the entire section to really piece it all together. You have to understand how each word is used and the specific language. A lot of times there's gray area in these documents. And so if there's gray area, the board will oftentimes create a ruling, which a ruling has the same force of effect as a law. And so in another section on their website, they will often put all the documents with their rulings so that you can scan through those and see if there's anything that applies to your specific license. In cases where there's a lot of gray area and it's not clarified by a ruling, then you can petition the board to write a declaratory ruling. And so a declaratory ruling only applies to one individual practitioner. We had this happen when I was on the board of directors for the New Mexico Association of Nurse Anesthetists. We had a CRNA who had his own pain management clinic, and he, with his attorney, wrote a letter to the board asking for a declaratory ruling to make for the board to state that he was in the scope of his practice if he were to set up his clinic. And so the Board of Nursing issued him a declaratory ruling stating that he was within the bounds of his within the scope of the practice. And so that's how you clarify any gray area that applies to your specific situation, is a declaratory ruling. So I hope that helps everybody kind of get an idea of where to check to find the rules, to get an understanding. Clearly these maps are like the most quick way, down and dirty way to get an idea of what the rules are going to be like in your state. Red is going to be a little bit more challenging. It's totally doable, but you're going to have to find a physician to collaborate with or have a supervisory role with. So if it's considered to be non-independent, if you have to have like a written formalized collaboration agreement, that classifies as non-independent according to the makers of this map, which was the National Council on the State Boards of Nursing. If you are independent or do not have to have a formalized collaboration, then they consider it to be independent. And so this just kind of gives you an idea of how to structure your practice, and I hope that helps a little bit. If you guys have any questions at all, just shoot them in the comments down here below. I'm going to keep posting videos like this as questions come up. Please invite anybody who's interested in healthcare entrepreneurship or who has started a healthcare related business to the group, and hopefully we can get a really large number of people to share their knowledge and help each other out. I have another group called the Ketamine Clinic Startup Group, and that one's growing really well. The other group has over, I think it's 2,400 members in it now. So if you're interested in ketamine, go check out that group. So make sure to share it, make sure to help each other out, make sure to post questions and answers to questions if you know the answers. And I hope you guys enjoy this group, and we will talk to you later.